Hello everyone, I am Dr. Sahiti Balmuri, consultant obstetrician, gynecologist and laparoscopic surgeon at KIMS Cardinals Gachibowli.
Hi, I am Dr. Ramya Valiveru. I am a breast oncosurgeon working with KIMS Hospitals Gachibowli.
Today we are here to discuss about breast cancer. So Dr. Ramya, who are at risk for breast cancer?
Women who have long estrogen exposure. For example, a lady who has early menarche in her childhood. That means she started to have her periods very early in life. And having late menopause, that means the periods have stopped a little later than expected. So these women have prolonged exposure to a female hormone called estrogen. So these women are at increased risk. So women who have first childbirth after 35 years and women who do not breastfeed and women who have not born children also have higher risk for breast cancer because these women also have increased exposure of unopposed estrogen on their breasts. Breasts are hormonally sensitive tissues, so with this hormonal influence, they tend to grow and proliferate more and they may develop cancerous changes. Women who are alcoholics, who are addicted to alcohol and smokers are also at increased risk. Family history is seen as a reason for breast cancer in only less than 10%, 5 to 10% of individuals. So generally if a lady has breast cancer, it is usually called sporadic. That means only the lady is going to develop breast cancer. If there are 2-3 in a family developing breast cancer, then the family history of breast cancer is said to increase.
So what are the common symptoms that are experienced generally in women who have breast cancer?
So in India, because we don't have a screening program, most commonly we see women with lumps, palpable lumps in their breast as of most common symptoms. Other symptoms and signs can be a recent, persistent, enlarged increase in size of one breast and a persistent area of redness, thickened breast and blood-stained nipple discharge. So these could also be signs and symptoms of breast cancer. And nipple retraction, that means a woman may have noticed that her nipple has pulled in and it is not coming out. All these could be symptoms and signs of breast cancer.
So if a woman is experiencing a symptom like this, how do you think a diagnosis is made to find out if it is breast cancer?
Yeah, so a lady comes to us with any of these symptoms. We first do a thorough history. We get all the answers for the questions that we just discussed and do a clinical examination. Then we subject the lady to imaging. So either in the form of a mammogram or mammography with ultrasound. Sometimes because the women may have very dense breasts, we may choose to perform MRI. So after this imaging, we get an idea and then we decide upon the pathological test that we need to do. So most commonly we do a core biopsy from the breast lump. These are all OPD based procedures and are not dangerous or painful. So with these 3 tests, we are able to make or refute the diagnosis of breast cancer.
There is a popular notion that mammograms are painful. Is it true?
Oh, thanks that you asked this question. It is not true. So if a lady has pain in her breast, even if we touch her during examination, she may have pain. This lady is going to have pain during mammography also. But if a lady has normal breasts without any painful condition, mammography is not painful. So contrary to popular belief and women getting scared that mammography is painful, it is not so. So with a proper trained technician and with the right amount of compression between the plates, mammography is a very, very simple procedure and many women go through it very comfortably.
Now once a diagnosis of breast cancer is made, is removal of the breast the only option for treatment?
No, Dr. Sahiti, we have options like breast conservation surgery or oncoplastic breast surgery where we remove the lump safely with oncologically good margins, reconstruct the breast to its near normal shape. But some women who have tumors, multiple tumors in different locations, or if they have precancerous changes, then in some situations we may have to remove the entire breast, or if a lady has a large lump despite trying chemotherapy if it doesn't reduce the size. But nowadays, even after mastectomy, we have options of reconstruction. So if the woman has undergone a total mastectomy, they can undergo reconstruction using either implants or using autologous tissues.
Hopefully we have answered most of your questions about breast cancer. Stay informed, stay healthy.
Thank you.